You're listening to the Your Knee, Your Health podcast. I'm your host, Adam Rosen. I'm a fellowship-trained, board-certified orthopedic surgeon who specializes in knee replacement. Here I'll talk to you about common knee complaints and other orthopedic issues. We'll cover other important health-related topics, all of which are meant to helpfully answer some of your questions and help improve the quality of your life. Thanks for listening, and on with the next episode. Hello and welcome back. This is Adam Rosen, and you're listening to the Your Knee, Your Health podcast. In today's episode, I want to talk to you about deformity of the knee. So typically you'll hear about people saying that they are, or they know so-and-so is bow-legged, or looks like a cowboy, or looks like he just got off a horse, or someone that looks more knock-kneed. Now, the reason that this occurs typically in an arthritic knee is due to where the person has lost the most cartilage. Now, there are some people that when they're born, the shin bone or tibia may bow a little bit, or the angle of their knee may typically be a little bit more than the norm. So typically when we talk about a leg being straight, most men, the leg is actually knock-kneed by about 5 degrees at the knee, and in women it's about 7 degrees at the knee. So there's a huge variation. But in any event, as we age and as we develop arthritis, you may lose more cartilage on one side of the knee or the other, and that may affect the alignment of your leg. So when we talk about the knee, there's really 3 parts of the knee where you can get arthritis, or 3 what we call compartments. So there's the front compartment, and that is what's called the anterior compartment, or the patellofemoral joint, patella being the kneecap and femoral being the femur. So between the kneecap and the thigh bone, there's a bunch of cartilage, and this is most commonly used when you bend and straighten your knee, climbing stairs, getting out of a chair, getting off of the toilet. So there are some people that will develop pretty severe or isolated arthritis in just that one part of the knee or compartment, and it's not really going to affect the way that their knee looks from the front or the back. But if you have more commonly an arthritic knee where the cartilage loss is on the inside of your knee, so what then happens is you lose the cartilage on the end of the thigh bone, top of the shin bone, on the inside of the knee. So that space becomes smaller, and then the knee starts to bow outwards. Now, if it's subtle, it may not even be noticeable, but as it becomes more severe, you lose more cartilage. You can even erode into the bone. And then what can happen is it starts to stretch some of the tissue and ligaments on the outside half of your knee. And that's why people, even though the arthritis on x-ray may be worst on the inside, they may have more pain on the outside. Now, conversely, if you have more arthritis on the outside, or what we call the lateral compartment of your knee, as somebody walks, they're going to have more of the pain on the outside due to the cartilage loss. But again, as the deformity becomes worse, you start to stretch out that tissue on the inside part of your knee. So you may also have pain on the inside of your knee. Now, there's kind of 2 basic types of deformity if you want to break it down into its simplest forms as far as stability. So you can have a fixed deformity or an unstable knee. So in some people, as they deform their leg, as it becomes more bow-legged or knock-kneed, because of bone spurs or tightness of other tissues and ligaments, they may be stuck in that position, meaning that the knee doesn't go back to straight. And this can sometimes be a little bit less problematic than in someone that has more laxity, because they may describe that because the knee is unstable, they may have more buckling or episodes of it giving way. So this is someone, when you examine them, you can straighten their knee, and when they lie down, it actually doesn't look so bad. But when they stand up, you see this huge deformity occur. And then as they walk, the leg is off the ground, pretty straight. They go to load the leg, and then it either becomes severely more knock-kneed or bow-legged. And that instability can cause a lot more pain and symptoms. So the end result for these people with the severest of arthritis becomes a knee replacement. And people always wonder, can I do more damage if I wait? And you still need a knee replacement if you wait and wait and wait. But if somebody has a severe deformity, sometimes the longer that you wait, the more it stretches out those ligaments, and we can't shrink those ligaments back down to normal. So sometimes it is a slightly more difficult surgery in the sense that we have to put in different implants to stabilize your knee due to the lack of the stability of the ligaments or the looseness of the ligaments. But for the most part, you're not really making yourself worse to the point where you can't have a knee replacement. Now, before that, you can do all the strengthening that you want, which will help stabilize the muscles, but again, it won't tighten up the ligaments. So this is where bracing actually may help, and it may help the symptoms, because if somebody has a severe deformity, if you brace them and they're not loading the ligaments on the opposite side of where they have the arthritis, it may prevent further stretching or damage, and also it may provide stability. So this is one of those few instances where someone has an unstable knee. It can be due to either a ligament tear traumatically, or in this case, sort of a stretching out slowly over time, or what we call an attenuation of that ligament. And if you can stabilize the knee with a specialized brace, you may actually decrease some of their pain by stabilizing the ligament, which is loose, and also unloading or taking some of the pressure off where the cartilage is bad. So I hope this little explanation really explains to you the difference between a bow-legged knee and a knock-kneed knee. These are really common questions that I get asked a lot. And it just helps, I think, for patients to understand what actually happened in their knee, which caused this deformity to develop, and what things that they can do to help their symptoms now in the form of braces, and definitive treatments that would be in the form of knee replacement. So once again, thanks for listening. I'm Adam Rosen. You've been listening to the Your Knee, Your Health podcast. Thanks for listening to the Your Knee, Your Health podcast. If you've not already done so, please subscribe so you'll be notified of future episodes. And if you enjoy what you're hearing, please take the time to leave a review. It helps other people like you find the show. I'm your host, Adam Rosen, and until next time, stay safe.